Welcome to the Dental Marketing Guy Show. I'm Justin, the Dental Marketing Guy, and today we have a very special guest. It is a huge honor to interview Debbie Seidel-Bittke. She is an RDH, BS, and she's a dental consultant, but she's not just any dental consultant. She's a coach, speaker, and author. She is a thought leader in the dental industry. And let me tell you, Debbie, she is the CEO of Dental Hygiene Solutions, powered by Dental Practice Solutions. And Debbie is a world-class leader in creating profitable hygiene departments. She's a well-known as a former clinical assistant professor at USC in Los Angeles and former hygiene department program director. You know, Dentistry Today recognizes Debbie as a leader in dental consulting. And let me just say, the resume for you, Debbie, is a very long list. We wouldn't want to go through the whole thing. But we're going to jump into the story of how you got into this, and then some quick tips that dentists who are watching can jump into themselves in order to increase productivity and morale and all these things that go on. But first of all, how are you?
Justin, I'm doing great. Thank you so much for inviting me, and I've really enjoyed getting to know you, just what little bit I know about you. We've had a really great time just conversing so that we could present this information to our tribe of people throughout the world, and it's been a fun adventure.
Absolutely. And you know, I know you've got a huge amount of value to offer. I'm hoping, but we could just kind of get into the why. Why did Debbie get into this? Why is, you know, obviously you've got the credentials, you've got the ability to teach and be a thought leader, but how did that come to be?
So, I mean, it happened a long time ago when I was 12 years old. We had to do a report for career day in 8th grade. So I decided that it sounded like fun. It was almost like being a cheerleader. It sounded like fun, and I did it on becoming a dental hygienist. I interviewed a hygienist, and I thought that would be cool. And I wanted to go to USC and be a Trojan, so I accomplished that. And I found myself cleaning teeth, and it got boring. And so I started thinking of what I wanted to do. Now, I had been working in dentistry since I was 17, right out of high school, and at about 10 years, first as a dental assistant, then as a hygienist, I started teaching at USC. I became an assistant professor there, and I was even teaching the dental students practice management, because by the time I was 27, 30 years of age, I had a lot of knowledge, helping two dentists to start their practice when I was just 17, 18, 19 years of age. And I really started pondering that I wanted to become a dental consultant. And I didn't know, I thought, well, I know dental hygiene, but what am I going to teach? And at that point in time, we were starting to learn about the oral health, systemic health link. And my mother had her mitral valve replaced. And she came in about 2 years later. She had a difficult time recovering from that surgery. And she came in a couple of years later, and I was her hygienist. I had just started working as a consultant. I was speaking and writing, and I had a few consulting clients, but I also worked part-time as a hygienist. And while my mother was in my chair, I was doing the comprehensive perio evaluation, and I'm probing around, and all of a sudden on number 19, the lower left molar, it goes like this. It should be normally 3 or a 4, and it goes 5, 8, 8. And there's bleeding. And I've never seen this on my mother. At this point, I had been a hygienist over 10 years and had been working on her even since I was in the hygiene school at USC. And knowing that my mom just had her mitral valve replaced and was having a difficult time recovering, I was very concerned. So the dentist that I worked for took a look, and we took some radiographs, and they found that she had an endoperio abscess. So she had the tooth extracted. And a couple months later, she was going to have a bridge replaced. And this is my colleague, that's the dentist. I went to USC with him. And she didn't make it back for all the appointments because she ended up in the hospital. They called me on a Saturday from the hospital, and they said that your mother has an infection in her blood. And what happened was she had an infection in her blood a couple months after I discovered this endo-perio abscess. And within 10 days, not only did she have an infection in her blood, but she had a hemorrhagic stroke on the left side. And then her kidneys began to fail. And she actually ended up losing her life. And it really made me think that I have a message to deliver to the world. It's very important because we now have so much research that oral health plays a key role in systemic health. And I had been talking to my mother about this, and she just thought, oh, she's an overprotective daughter. But this is very important, and I believe that it's my role now to share with the whole world that if we can help our patients live a longer, healthier life through having a healthy mouth, that we can take them from this situation that my mother had. And it's really been helpful for my colleagues who knew the situation. They were in my life at that time, and they're hygienists and dentists. It's been helpful for them to share with their patients how important your health is. And we know now, this was in 2002. This all happened the beginning of 2002. And I have to tell you that we have so much more research, and there are many offices that I talk to throughout the world who don't know about this research. They don't know about pancreatic cancer. They don't know about Alzheimer's, that it probably all starts with the oral health. It's inflammation in your mouth that goes to your blood and causes these other diseases. And so that's why I do what I do. I coach and consult offices all over the world. It's very rewarding because people in other places in the world outside of the US had a meeting with a dental hygienist, not an office, it was a dental hygienist who's new to dentistry in Australia. She did not understand this message. She thought that her role was to give the patients knowledge about brushing and flossing better.
Wow. Wow. I did not expect that. That is a very powerful reason to do what you do. Thank you for sharing that. It's kind of interesting because what I try and help dentists with is kind of develop a story that they can tell their patients and put it out online, put that kind of content out there. And I would have a really tough time finding many dentists with that powerful a story. I think what makes it really powerful is I mean, it's really meaningful, and there's a conflict there. There's an obstacle that you overcame. How would you say your work, how do you find meaning in helping dentists, and specifically, how do you help dentists, and how does that tie back to what you just shared?
One of the main reasons a dentist will call me, it's been happening for, gosh, when we had the economic decline back in 2009, 2010, I remember all the time my phone was ringing that doctors were in a panic that they had a bleeding, a hemorrhage in their schedule. That's how I've been able to help doctors, is through them sharing this message that their patients aren't coming to get their teeth cleaned. People thought that they were saving their way to prosperity by not seeing their dentist back in 2008, 2009, 2010. And even today, I still hear from doctors all the time. In fact, I've heard in the last 4 weeks that there have been at least 4 doctors who have contacted our office because they have a hemorrhage in their schedule. And so it means that when your patient comes into your office that they're more than just a tooth, they're more than just a mouth. And so we work step by step. We take baby steps with our clients. For example, a doctor was telling me last night, and a lot of doctors, they're really scientific. They're very clinical. They're there to do dentistry. And the doctor that I spoke to last night, he said, I'm going to admit to you that I'm not very good at connecting with the patients. And what we talked about is that patients they judge you about how good your dentistry is by how you make them feel.
Right.
And he just bought this practice in the last 2 years and notices there's been a lot of patients leaving. The doctor who previously owned that practice, he's redoing a lot of the dentistry, but he connected with the patients. He got right into their heart. And they call him, that doctor that's no longer there, they call him their friend. And that there are doctors that come to us who are clinicians and they want to be the clinician. But we have a way that we're teaching the other team members to connect with the patients and then bridge that gap with the patient and the doctor. It's the team member that's doing that. In one of our teams, we were working on an activity, and I always give out challenges to the team. And then we had a follow-up call a couple days later. I followed up with the office manager, and actually some of the team members were talking to me that day too, and they were like, oh my gosh, we just had so much fun. And the day was amazing. And it was all because the doctor came into the room and the assistant shared with him this tidbit of fun information about the patient. And now they were having so much fun. And not only that patient appointment, but it just went over into the whole day, and they were so excited. And that's the change that I love making. And it's when your patients understand that they're more than just a mouth, when they know that you care about them. Number one, you find out something that's very important to them. Jason and I found out a little bit about you before we started this podcast, and now you found out something even more I didn't tell you about before the podcast, but I feel like I know for sure after this podcast, we're going to keep a connection going. And that's what I'm talking about. That's how we fill the holes in the schedule. And doctor gets to be a clinician, and the team members, the whole team, including the doctor, gets to have a lot more fun. And the patients have a reason to return to your office. Not only that they have a connection with you, but we're also teaching them how to understand what's valuable to that patient. It could be money, time. It could be that they have a fear, anxiety about being in a dental office. And how do you connect with them about their value and switch that around to a benefit for them? And these are some of the ways that we keep the schedule full. We stop the hemorrhaging.
Nice, nice. Well, excellent. I think that gives a lot of context to what you're doing. Would you be able to share with us some quick tips that dentists can actionably take on their own to improve their hygiene department?
Well, most doctors say that they want the hygiene department to be more productive. And we look to see if your hygiene department is producing about 25 to 30% of your total production. Now, if you're mainly doing implants all day, that's going to be a different percentage. But for the general practitioner, your hygiene department should be bringing in about that much of the production. And that is not usually what's happening when somebody reaches out to us. And how that can happen is more patients accepting your care and wanting to return to your office. And how does that happen is, number one, it's the relationship. And that relationship begins with maybe the first click to your website, or it could be the first call to your office. So what's happening there to connect with your patient? And then what happens with that connection verbally? And do you understand what's important to your patient in their personal life and in their oral health? What are their needs that they came to your practice for? And addressing those. The other thing is that you always want to give your patients a reason to return. So for my mother, it was the mitral valve has just been replaced. Her immune system was compromised. She had other health issues. And it's very important that we get the infection and the inflammation in her mouth under control, that it's stable, that we don't have inflammation and infection in the mouth, because that goes through the bloodstream and causes other health problems. And in my mother's case, it caused death. So what is that reason? Each patient has a various reason. I don't have periodontal disease, and I don't have active tooth decay. I haven't had a cavity in my mouth since I was 17. So what is the reason that Debbie needs to come back to see her hygienist every 6 months? She's doing a really great job with her home care. They rave about that. But as I get older, I am more likely to have other diseases, like my colleagues, my girlfriends who I grew up with, high blood pressure, high cholesterol, borderline diabetes. These are some of the things that can happen to us. Breast cancer, runs in my family, have a history
Really?
of.
Wait, hold on. These, so I know there's a link, but for the listeners, most of them being dentists, they already know this as well. But are you saying that, because some people looking for a dentist might find this video searching, um, are you saying that even breast can there's a link to even breast cancer to oral health?
Yes, when people have breast cancer, they have it's interleukin 1, 6, 13. These are hormones. They're enzymes of inflammation that are in our blood, but there's a thought process, and we've got research to show that in periodontal disease, these enzymes, these hormones of inflammation, these inflammatory markers, they're elevated. And that corresponds with prostate cancer, colon cancer, Alzheimer's disease. When you look at their blood and what are the different inflammatory markers, they're the same as periodontal disease. And
I have a, oh, go ahead.
go ahead, go ahead. What's your question?
Well, I'm just thinking outside the box here because I think you're probably really familiar with this. Um, People really trust doctors, and I think dentists sometimes deal with a deficiency of trust right off the bat compared to a medical doctor. And I think some of that might have to do with the fact that healthcare for many people is quote unquote free, where which you know what that means. It means just they're not actually paying with their credit card at that point. For instance, like an emergency room visit, they're not like, okay, we need your credit card before we do this procedure. You just go in there and you do it. But for whatever reason, society seems to trust dentists less than medical doctors, and I think it's nuts. But just keeping in mind some of what goes on behind that and some of the reasons for that. Do you ever have a patient say, well, you know, if the oral health, if this is not just made up by the ADA and people like Debbie and, you know, some dentist who wants to buy a new car, why doesn't my doctor tell me to go to the dentist? Why doesn't my doctor say, get your teeth cleaned? Because my doctor knows about my overall health and he never mentions that stuff. Do you ever get people asking those kinds of questions, or at least maybe thinking that stuff and not saying it?
Well, there are always going to be skeptics, but honestly, the doctors, the physicians that I go to are the ones that understand that your oral health is related to your total health. You see, my mother had mitral valve prolapse, and then she had rheumatic heart fever when she was a child. So that valve got worse and worse. I was born with a very slight heart murmur, mitral valve prolapse, very, very slight. And so I've had echocardiograms and I've been seen by cardiologists. And the cardiologist, they knew. And my cardiologist said, we think that it probably starts in the mouth. If there's a doctor that's not thinking this is connected, you need to find a new physician.
Yeah, and I think, you know, a lot of medical doctors, nothing against medical doctors, it's definitely a noble profession, but they're kind of the quarterbacks of the medical industry. It's like you just kind of go there first and then they give you references, they send you different places to specialists. But yeah, specialists like cardiologists, you know, they're able to much more pinpoint. They're able to pinpoint exactly the root cause of things much more effectively. as opposed to just an initial exam. Speaking of initial exams, um, that's a big deal. Do you help dentists only? Like, do you work only with the hygienist? Do you work with the front desk at all? Is there kind of a cohesive theme to this, or is it mainly just the hygienists who need to know these things?
Well, everybody needs to know it. And so the reason why I'm hired is because of the hygiene department. However, I work with everybody on the team. And so we monitor what goes on in the hygiene department. However, most of my offices, the client offices now, they're actually saying, oh, we kind of like that you're looking at that. So we look at weekly. And we work with Denometrics, which is a monitoring system. And they're actually working because I monitor what happens each week. So how many patients does the hygienist see? They usually see 8, and I know the names of those. I see those patients. It's all HIPAA compliant the way they give that to me, but I know what they came in for, what are they scheduled for next. And the reason why I started doing this is because many offices, when we were starting to work with them, when I would observe what was going on in their office and then I left, I would notice at the end of that observation that $26,000 would walk out the door in unaccepted treatment. So I can help the doctor to close that back door on that situation. However, I want to make sure that it's changing like it needs to. And so Denometrics is actually able to pull those numbers from their doctor's dental software. So we monitor that. But the front office is now saying, my last few clients are like, we want the front office. We want to see what's happening all over the practice. So we're monitoring those things for the office. So I'm working specifically with the hygiene department, but the whole team. I believe that to be successful in your practice, it needs to be the team in the driver's seat so the doctor can be the clinician. So they have to know what the right hand's doing and the left hand's doing. And I want to make sure that all the gears are well oiled. So I do look at what's being billed. There are many offices that when we first start working with them, we have a 50-foot sky-high view of what's going on, what's being billed. And I can say, oh, this is a service you're not providing your patients, but it should be done. It's the standard of care. And by the way, most insurance companies will pay for that. I don't believe in talking to your patients, oh, insurance is a benefit, and that's a whole nother podcast we can do. But we want to get our patients away from being dependent on their insurance. And by the way, people do have to pay for insurance. They might not know it, but it's being deducted from their payroll. Nobody in today, unless you make $10,000 a year in the US, you're paying for insurance somehow, some way.
Right.
You and I are paying a lot of money for it.
Right. Well, and that's the thing is that if a dentist accepts Delta Dental and you work for the state and you think it's free, so I'm not going to take advantage of it, that's crazy. I mean, there's no such thing as a free lunch. You are paying in one way or another.
Right.
And so, but what's interesting is a lot of these people with dental insurance still don't go to the dentist.
Exactly.
And it's like you're getting double billed because you've got the health issues like you mentioned. But yeah, that's kind of a rant we could go on another day. But kind of bringing it back to what you do, I'm hoping to get maybe 1 or 2 more actionable tips so the dentists and hygienists who are interested in increasing production can really take action on.
So one of the other things I wanted to share is that it's really important when you have your patient in there. So I have it like down to a science. It's a step-by-step process. So we talked about that relationship with your patient, engagement with the patient, and when your patient has a relationship with you, they're more likely to be engaged with you, meaning that they're going to open up your newsletter or blog. They're going to want to see your blog. They're going to want to connect with you on your Facebook, and they're going to like you. They're going to be your raving fan, and they're going to tell everybody about you, just like I'm going to be telling everybody about you, Justin, after the podcast today. Always give them a reason to return, and it's according to what's valuable to them and also letting them know what are the benefits. And the other thing is to create a partnership with your patient. And that means that we're sitting like you and I are sitting eye to eye, face to face right now. And that's the same thing with your patient. They're not, it used to be that they're lying back in the chair and doctors got masks on and gloves and they're talking to the patient. And they're, you know, down there like this. And we want to be like this. We want to show our patients what we see. Justin, do you see this? Look at here. See this red right here? You see that upside down V in between the teeth and how red it is? Do you see this area right here that's bleeding? Do you see this right here on the x-ray that we took today? See this spot right here? That shouldn't be there. That's called tartar, or you might have heard of calculus. It's not supposed to be there. It looks like a little spur on the side of the tooth. And that's what's causing, it's, you know, so you see how you and I are sitting together and we're looking at these things together. And I think that letting the patient see, asking them questions where they get to tell you an answer, which is not yes or no. What are your thoughts?
Self-diagnosis.
I'm sorry?
Like self-diagnosis. Like they look at the x-ray and they're like, you know, the doctor says, what do you think that is? And then they say, well, looks like a cavity. Yep.
It's like, you know, there's another thing that we do with the periodontal comprehensive exam. And there's a whole process that we teach so that the patient, before they're even finished with the numbers and the exam, they're like, oh my gosh, oh no. You know, they already know by the time that exam is finished, things aren't right because you've educated them on what's to listen for. And then you're going to look at it together. So they heard it, now they're going to see it. And seeing is believing. It paints 1,000 words to them when
Absolutely.
they see it.
Absolutely.
So they heard it, now they're going to see it with their own eyes. And they've already, remember, they already created a relationship. They're already engaged with you. They created a partnership now with you. They're more likely to say yes. They're going to come back to your office. They're going to be your fan.
Absolutely.
So this is the whole process. The other thing I wanted to say is, you know, everybody, I've talked to this one doctor about a month ago, and he said, well, you know, most dentists don't want to hire a consultant because they cost a lot of money. And I want to say, what is it costing you to have those holes in your schedule every day? So I'm working with Dr. Bill Williams right now. He's a mastermind guru with the doctors to create a $500,000 practice. And I'm the boots on the ground. I'm the advocate for the team. So what they're learning, the doctor's learning with Dr. Bill Williams, I'm there on calls with the team, on webinars with the team. I'm going in the office and I'm with the team. I'm their advocate. I am not the IRS coming in to audit you. And it happens so many times that everybody, you know, I had a client earlier in the year and I didn't even get a chance to meet the two ladies at the front desk. When they heard he hired a consultant, they quit. I didn't even get a chance to meet them because we have this connotation. We have a bad rap, you know. And I'm there to be your advocate. I'm there to make it fun. And I'm there to make you enjoy your day. Just like I told you earlier with that office, the ladies the other day were like, oh my gosh, the doctor, we were having so much fun with our patient.
Yeah, yeah.
Justin.
That's really incredible. So I'm thinking, you know, my job is to kind of put myself in the shoes of the dentist or the hygienist watching this. And we're coming to a close on our time now, but I did wonder about, you know, I think a lot of dentists assume that, you know, if you bring in a consultant, you're bringing them in for life. Do you offer programs? What options do you have in terms of like maybe like webinars or videos or one-on-one consulting? Do you go to the office or do you do for virtually like this? How does that all work? And you know, is the dentist signing his life away when he hires you, or is it a temporary thing? Tell me how that works.
Well, a typical client will be for 6 months. That's how they start with us. And we customize everything for the client according to their needs. And so what we teach the doctor is what we do in our office here at Dental Practice Solutions. And so we work with you for 6 months usually. And most clients will have a day and a half at the beginning of those 6 months and a day and a half at the end. However, we do have clients that need more, so we give more days in office. We customize it according to what you need. We have a lot of webinars with the teams, a lot of calls, just like you and I are Skyping with each other. We do a lot of video trainings. We have video trainings for all of our clients, but if somebody's in another continent in the world, which is very common, we're on Skype, we're on webinars, they're doing videos to show me what they're doing. And then we look at those videos together and tweak things. So it's almost like I'm there, but through video, because they've done a video to share with me.
That's amazing. Okay, so you're doing it virtually, and wow, that's really cool that you actually get their chair side, and I'm sure it saves on costs too.
Yes.
To do it virtually. Well, that's really cool. Well, where can they find you? I know you mentioned Bill, and where can they find you, Debbie?
Dentalpracticesolutions.com. And our toll-free number is 888-816-1511. Our email is support@dentalpracticesolutions.com.
Excellent.
We have a wealth of information on our website.
Very good, very good. And and I'm trying to get dentists to put their information. You got to start with the FAQs, and then, like you said, build that trust, get that useful, engaging, educational content on your website, and definitely chairside. It's very important. That's why every dentist wants new patients, right? Because they get an opportunity to knock it out of the park, and it sounds like you help them hit it in the right direction.
Well, we're also helping them to keep their new patients returning to their office indefinitely. And that's the big money maker for them. It costs a lot of money to get a patient to your office. The most important thing is to keep them there.
Absolutely. Absolutely. Yeah. And I'm a fan of it because, when I do SEO for dentists and build them a website, it's like, man, if they're not providing world-class care, the ROI drops. And then how is it attributed? It's usually attributed to me. So fortunately, that's not the case with my clients. But yeah, I think it's because of the education that you provide and people like you who are going out there and just making sure the dentist, the clinical skills are understood by the patient, because just like SEO, if you don't understand it, if you don't know the value of it, if you don't know the minutia, if you don't know like the important details, it can be tough to demonstrate the value. So
Yeah.
thank you very much for coming on.
It's been such a great pleasure. I enjoyed getting to know you as well.
Thank you. Yeah. And so guys, if you want to contact Debbie, you've got dentalpracticesolutions.com. And thank you for watching the Dental Marketing Guy show.